Hi, everyone. I'm Melody Palmer-Arizola. While we're waiting for everyone to join us, we're going to do a little icebreaker. And so I'm going to start with the panelists, and then we'll do a poll at the end. So if y'all could have one or more thing, what would it be? Money, fame, free time, or something else? Who would like to start?
Ladies first.
Okay. Suzanne, how about
I would say free time. Definitely free time with my family and kids, away from social media. I'm just gonna put that out there now. So yeah.
start with that? Okay, Nidia?
Yeah, I think I'd say free time as well. But of course, if you've got free time, then you might need some money to enjoy your free time. So I don't know. It's kind of double.
50-50 there?
Yeah.
Okay, Derrick, how about you?
Definitely free time. Time is just constantly fleeting. There's not enough free time. There's not enough time to get work done. So the more time I can have, the better.
Okay, you know, it's funny, when I first saw this, I was like, I was kind of like Nidia. I was like, well, if I had money, then I'd have more free time, so I wouldn't work as much. So a little bit of both.
Touche.
All right, thanks y'all for doing that. We're gonna put the poll up, and y'all can, you know, answer what you would choose. Daniel? Okay. I don't know, I may not be able to see that, so I'm just gonna get going because we don't have a lot of time, and we got a lot of, it's a, you know, a lot of stuff to, oh, there it is.
There it is.
All right. I guess I don't get to do it. Oh, I can't vote, so I'm just gonna minimize it. All right, so I guess we'll wait a second to see what the results are. What do y'all think is the most?
Same free time.
Free
I'm
time.
gonna say free time too. Yeah. Okay, well, I'm just to get going, and if the results come up while we're talking, we'll just take a break and look at them quick. So just in the interest of time. So it's always interesting to see what people are going to put for that, though. So let's get started. So again, good afternoon. I'm Melody Palmer-Arizola. I'm the practice administrator at Child and Family Services at Integral Care. Thank you for joining us for today's community forum, The State of Our Children's Mental Health. This forum is co-presented with NAMI Central Texas. NAMI works to improve the lives of individuals affected by mental illness through education, support, and advocacy programs. And just to let you know, we are recording today's forum and streaming on Facebook. Integral Care is the designated local mental health authority for Travis County. For over 50 years, we have supported adults and children living with mental illness, substance use, intellectual and developmental disabilities. In these recent years, we've seen significant mental health disorders in children and youth, increases in certain mental health disorders in children and youth, including depression, anxiety, and suicidal ideation. The COVID-19 pandemic era introduced a new set of challenges for children and youth in the U.S., but children and youth have been struggling for far longer. According to the CDC's Youth Risk Behavior Surveillance System, feelings of persistent sadness, hopelessness, and suicidal thoughts and behaviors increased by about 40% among young people over the last 10 years leading up to the pandemic. I'm honored to welcome today's panelists who will discuss some of the macro level factors that are negatively impacting the mental health of our children and youth. We'll talk about signs parents can watch for. We're going to talk about how to start a conversation around mental health. And we're going to talk about resources available for parents and caregivers. So we have Dr. Suzanne C. Hart. She is a lead psychologist for Austin Child Guidance Center, which specializes in treating underserved children and the adolescent community. Dr. Hart has over 16 years of experience and specializes in mentoring and training early career clinicians. We have Derrick Lewis. Derrick is an LPC-A and a program manager for Integral Care's Child and Family Services Outpatient Clinic Division. He is currently managing 2 of the 3 clinics that we have here in Travis County area. Derrick graduated from the University of El Paso with a bachelor's in December of 2014 and He graduated from Lamar University with a master's degree in clinical mental health counseling in December of 2020. Then we have Nidia Heston. Nidia and her husband are parents to a young adult who lives with autism, ADHD, bipolar, and PTSD. For over 25 years, Nidia has worked with families navigating child serving systems, including education, mental health, intellectual and developmental, juvenile justice, and medical communities. We're going to start with a panel discussion, and then we're going to take audience questions for about the last 10 to 15 minutes. So please type your questions in the Q&A box at the bottom of your screen. We'll try to get as many as we can, but if we run out of time, please put your email address so we will get back to you with your answers to your questions. So, we all ready to go? All right, we're going to start with the first question. We know that mental health is shaped by many factors, including individual traits, our families, communities, environment, and then society at large. What issues are you seeing impact the children the most in your practice right now? Dr. Hart, would you like to start?
Right now, what I'm seeing are really leftover effects of the pandemic. I mean, they haven't gone away, but it's effects of the pandemic because most of our population that we see is in school or about to go to school. So we see just a lot of kids that need some help with coping just with regular life, as far as kind of coming up with their identity, as far as frustration, learning how to deal with frustration, learning how to deal with maybe demanding classes or just going back to school and picking up into routines and following them. Lots of things as far as stressors, negotiating with multiple stressors, as well as what's going on with their parents and family. I mean, we see a lot of kids with a lot of trauma. So they come in with quite a bit already because of so much trauma that's been going on with the family. And and a lot of them are very, very resilient. But then when you put the pandemic and going back to school and maybe some health concerns on top of it, it's just a whole lot for a child to carry. So we try to teach them coping skills, help with anxiety, symptoms of depression, just kind of level things out, get the communication going.
What do you see with their relationship with peers? Oftentimes kids don't have a private practice and they come in and, because 2 years of their life, they were kind of separated from their peers. And sometimes in different developmental stages, that's extremely important, right? That
Exactly.
they have this interaction with their peers. So how do you see that affecting the kids you serve?
So a lot of kids are they've missed out. So as far as socialization, so the younger kids maybe have some difficulty getting along with peers, learning how to work in groups, learning how to walk away from something that's just happened and letting it go, kind of like pivoting into something else that can be somewhat difficult because they just kind of fixate. And so when in a regular classroom specifically, I mean, you have to keep going and there's more tasks to do in different classes. And so we see a lot of that where there's some difficulty there. It's just some frustration. Maybe it's the workload, maybe there's some learning disabilities, things like that. With older kids, we see most of them kept up with their peers. They just didn't see them. And they're keeping that level of activity. It's like a fear of missing out with all these different friend groups while they're in regular life. And so it's a lot to handle. It would be like being in 5 professional clubs at all times and talking to them, moderating at all times. It's a lot. It's a lot just to hear about it. So, yeah.
That brings up the technology piece, which Derrick, I think you're going to talk about because just getting on here, we were talking about Dr. Murthy, our Surgeon General just released a report and kind of a warning that, social media is the driving force for the mental health crisis with our youth. If y'all haven't looked at it, please look at it. It's an excellent report. So Derrick, how do you see the impact of technology and, especially during the pandemic time when kids, all they had was either texting or, it was all through social media that they interacted with others. How do you see that affecting our kids?
Exactly. Yeah. And I'll start by prefacing that the Surgeon General's warning came out at a perfect time right before we're having this forum. So thank you to him for not just that, but all the work that he does, of course. But I do believe that from a lot of things that I've read and seen and the kids that I've worked with, this was kind of a culmination of a couple of years of buildup of social media use with our kids as soon as social media became available on smartphones, which was around 2012, 2013. And at that point, we started seeing very high increases in self-reported measures of depression, self-reports of suicidality, and self-reports of self-harm. I did some research into some of these issues, and there was some pretty astonishing numbers that were provided by a social psychologist named Jonathan Haidt. What he found was that from the year 2009 to 2016, self-harm increased about 62% in kids ages 15 through 19. Now, even more astonishing was that during that same time frame, self-harm measures between kids aged 9 through 14 actually increased by 189%. So that's almost 2 times more over the course of about 7 to 8 years, which aligns but is not completely causal with, of course, social media being actively available on smartphones, online, just readily available to everybody. The pandemic was a culmination of that, because I think we can all speak for ourselves. We're having this on a, technology platform. So there are some benefits to that, which I'll kind of get to here shortly, but they were basically just left to have to use all of their technology resources to complete school, to interact with their friends, to keep up with current events even. And so they were basically forced into a technologically based world where everything was based off technology. They couldn't go and play outside. They couldn't go and gather with their friends because of obvious reasons, the fear of the pandemic. And so we almost forced all human beings, but especially our kids, to be on technology in one way or another. And then now we're kind of seeing the difficulty in reintegrating back into what we can consider normal life, right? Especially socially. I think what we've seen a lot is, and I've worked with multiple kids who say that interacting IRL, which means in real life, is much more difficult for them than interacting online. And a couple of reasons that I've heard from them is online, when you're texting somebody, you can actually kind of wait and process and think about what you're going to say before you say it. Whereas when you're interacting with somebody directly in person, you run the risk of saying something wrong or saying something that might come off as dumb. And so there's a lot more pressuring for our children to interact in person because of what was kind of forced upon them via the pandemic and that whole situation. And so socializing has definitely become a lot more difficult with our youth. We've seen very high rates of social anxiety. Even in the Surgeon General's warning, some of the stats that he threw out there were pretty wild, to be honest with you. What he found is teens aged 13 through 17, about 95% of them are active on social media, with about a third of those saying that they use it constantly. So when we kind of do the calculations there, about a third of our teens are constantly on social media, right? On top of that, most of them report an average of 3.5 hours of social media use per day. And what's also been found through various research, I want to say this was through the Pew Research studies, was that any more than 3 hours of social media use daily doubles the risk for our youth, children and adolescents, for risks of depression and anxiety. So basically doubles that anytime you're using social media more than 3 hours a day. And what's interesting, and I think this kind of speaks to the addictive factor of social media, is 50% of the kids that they basically conduct this self-report measure with stated that they feel that social media use actually is detrimental towards their mental health, especially towards their self-image. So even though they know that it's not necessarily the best resource for them, they're still actively using it. And I think we've seen this with our kids as well. And I think this is what makes it hard for not just kids, but for parents and for the community to address, is that this is a technology, social media and phones and all technology has seemingly just gotten out of our control. It's everywhere. We can't avoid it. And so I've seen situations with certain kids where parents are trying to make the right decision and say, I know the dangers of social media. I know what this comes with. So I'm not going to let you have a phone until you are in high school. But then you go to middle school and basically all your peers are on their phones. They're talking about what they saw on Instagram yesterday or showing each other TikToks, and you're kind of the odd person out. And so it's kind of hard for anybody to really restrict any sort of technology use, whether it's social media, whether it's video games, whether it's even TV, because let's not forget that TVs are actually a form of media.
Yeah.
And so I think we've gotten ourselves to a point where it's not necessarily about restricting, but it's about managing and monitoring. It's just not possible to move away from any sort of technology at this point.
And yes, and I agree with that. And so in the interest of time, again, I suggest everybody read the report because Dr. Murthy, it also talks about what parents can do in terms of social media, just kind of briefly like creating a family media plan, create a tech-free zone in the house to, you know, foster those in-person relationships. But he's got a whole list. So I do suggest, you know, everybody checking out that report. And speaking of, you know, like if you're a parent, what do you do? So Nidia, maybe you can address this next question. So for many parents and caregivers, it can be hard to tell if a child is just going through a phase or if there's something deeper going on. And what signs and symptoms should parents watch for that could indicate their child is struggling with their mental health?
So going back to just kind of the initial conversation and discussion, it's so hard, right? Because we don't know what it is. Is it social media? Is it a lot of different things? Daniel, when you were reading, or Derrick, I'm sorry, when you were reading about that report, I think it was 2009 to 2016, I was trying to remember in my head what was going on around that time. I seem to remember a lot of PS5 and video game and online gaming kind of coming on. I don't think really we had a lot of, kids had a lot of access to smartphones and social media, but so from what I remember working with children and families at that time, and my own son, is the video gaming. So, and you know, we can continue to go back and think about the different things that are just really vying for our kids' attention, and can really just influence how they're feeling. I like kind of just what you wrapped up there with, Derrick, is that as parents, and Melody, as parents, you know, it's up to us. We have to be the ones that are, right. I always think of the mama bear kind of metaphor, is we have to be the bear. We have to, as parents and caregivers, be bigger than all of those other things, because there's always going to be something. You know, we mentioned, okay, you're not old enough to have a phone. But if we don't develop those skills and help children and youth manage those skills, and if you do feel bad in getting back to, is it just a phase? Because we don't know if it's a phase, address it, right? Address it head on. I see you're feeling this way, or I see that you're angry, or I see that your feelings got hurt. A lot of times it's because they felt betrayed, they feel left out, feelings are hurt. That was one thing that we used a lot with my son, because you know, he didn't know what the feeling was. We didn't know what the feeling was, but we always know there's hurt feelings. So a lot of times just really having normalized conversation with your children and your youth at home. I see questions, you know, about children in different situations, foster care, LGBTQ+. You know, just normalize having those conversations. I looks like your feelings are hurt. It's hard to do that when you have a teen or an adolescent who might be screaming at you or yelling at you. But you know, as parents, part of what we talk about as well is to take care of yourself, so that you're in a well place to be able to address that that screaming or whatever is coming at you as a parent. But you know, just acknowledging that feeling, or that you are observing that there's a big feeling, is the place to start. And then of course we always talk about, if you see that this is happening for more than 2 or 3 weeks, or there's a huge change, for my son, what we saw with his, I think for us was really depressive, and the difference between the depressive symptoms and the manic symptoms for him. That's when we were like, this is really different. This is not what I've typically seen in other kids, or even in him in previous months. So we know our kids, as parents and caregivers, we really want to empower you to be the expert in your kiddo. And also we'll talk about some resources going forward.
You know, I like what you said about normalizing it, because, you know, we always talk about mental health, that mental health should be addressed just like if you have a physical problem, you talk about it, right? You're not going to ignore it. So kind of like mental health is the same way. And, you know, my kids were lucky. They grew up with a therapist as their mother. So they like, we've been talking about feelings since they were born, right? They're like, oh, we're talking about feelings again. Great. You know? But the more you can normalize, you know, just that openness and that, you know, and I think it's important as a parent to let that child know that you are able to hear anything they have to say.
Right.
Because a lot
Definitely.
of kids are like, I don't want to burden mom or dad anymore. They got enough stress. I can't tell them I'm feeling suicidal because they're worried about the bills being paid. Right? You got to let your child know that it's okay, that you can hear anything they have to say.
I definitely agree. I want to hop on that because one of the things that I try to stress just with my own kids, and believe me, my own kids, they may or may not share everything with me, of course, because you know they're my kids. But I try to stress with my clients and everything. Parents can handle anything. Okay. They've been around before. They can, not their first rodeo. They can handle what you're going to bring to them. And they have feelings too. They've gone through some things as they've grown up. They can relate. They can relate to, you know, puberty, body image issues, being scared, being excluded, you know, social status, threatening things that are happening that can threaten, like with different cliques, and it's not just girls, it's guy groups as well, different athletics, different science groups, everything. There's rankings within, and it's kids' egos are fragile and they're kids, you know, and it's very hard to be shut out, and it's very hard to acknowledge those feelings and talk about them. They may be embarrassed to their parents, but it's something that is going to happen throughout their lives. They're going to try out for jobs they don't get. They're going to get into things that they're good at, but other things they're not going to be good at. And we try to share that with parents. Your kid's not going to be good at every single thing. You know, they can do some things very well, but let's just normalize the regular human beings, you know, and how can we set this up for them? I think one thing I do want to put out there, since the pandemic, I think parents are really trying to make up for lost time. I know the schools are, I know the testing is. We're not seeing it on the testing front. We're seeing a definite lag behind. All of the tests that are going to come out from the publishers are going to be redone because of this, as well as for the populations that they put the test together on, you know, as far as, you know, representing all of our community exactly the way it appears, and not just a group out of, you know, some place that one university wrote on over and over again. When you get into high stakes testing and, you know, publishing, there's a whole thing about it. So I would say leading into this part is be there for your kid emotionally. The rest of this stuff is going to come around. The emotional stuff of where they are right now is so important. And they can handle this. They can handle you with this. They may not be in, you know, calculus, you know, college calculus, you know, at 15, 16, 17, and that's okay. They're still going to graduate high school. They're still, you know, but right now, do they really need that? You know, we just came off a very significant amount of time. Parents were getting laid off, everything changed. And I feel like we're expecting this generation to just pick up and run with it. And they can't, and they're not supposed to either. It's not fair to them. And it's not fair to us as parents to have those expectations. I would say as a parent to just keep your expectations very real and in the present, and things will work out. I can honestly tell you. And if you need communication skills, I mean, go to therapy yourself, bring your kid into it, but just start normalizing where we are. You know, we're at a very special time here. It's going to be okay. Young kids will learn how to adjust in class and learn how to participate because they want to. They'll learn how to, you know, be on teams and play a role and everything. They might get it at 7 or 8 instead of 5. That is okay. That doesn't mean that they're going to have, you know, antisocial traits down the road at all. It's just they're coping based on what has happened within their generation. And so, I went on a tangent there, but it's just something that, you know, I see it all the time. And I just want to tell parents it will be okay. You've got this, you know, if you're concerned, get some help for yourself, because you deserve somebody that can listen to you at all times and only care about what you think, even if you just talk about your kids the whole time, but it's imperative.
Yes, great. So we've been kind of talking about this, but, you know, I want to just kind of ask a question. If y'all have, Nidia, you may as a parent want to add to this too. So oftentimes it can be hard to have conversations around mental health. Parents may not know where to start, what to say, what not to say. What advice would you give to a parent who wants to start a conversation with their child about mental health? Nidia, what do you think about that as a parent?
Advice is bring the snack they like. Bring the snack. My kid loves these
I love
pizza
that.
rolls from, I'll just say Double Dave's. He loves the Double Dave's pizza rolls. And sometimes, that's just what it starts off with. Right. I may know in the back of my mind that something has been going on right now. He's doing a lot of adulting. He's 20 years old. So there's lots of stuff that's happening to kind of move into that adulting phase. And he did tell me, he goes, Mom, this is a lot. We went and bought the pizza rolls yesterday and just had, a frank conversation about it. It's okay. Dr. Hart, I love what you're talking about school. Parents who might be anxious about their academic standing for their children. Just yesterday, I was walking through a park and saw someone I knew, and this is the conversation we had. And they said, I've realized it's okay. They're going to learn how to read. They're going to learn how to do math. They're going to learn all the things. But right now, COVID was huge. I kind of think of it as, maybe, I don't know, someone tears their ACL and has to have it repaired, right? You don't just have surgery and rest a couple of days and you're back to your previous activities, right? You got to take care of it. There's some rehab that happens. You have to learn how to do things differently until you feel like you're back to where you want to be. And back to where you want to be may not be, or it may not look like what it looked like before. And I think it's parents and caregivers, a lot of times it's our job just to get up and keep doing the thing. But for what we have to realize is that for children and youth, that looks different. It was, we keep saying COVID was a big thing, but I think as adults, hopefully we're getting support. And, if we were laid off, if we did have illness, if there was death, hopefully we're getting help around that so that we can now help our children and youth work through, how they were affected, because we know it was huge. We don't know yet, right, the long lasting effects for them. But again, just bring the pizza rolls and have that conversation. I was just, and I know we'll talk about it in a minute, but Integral Care and Austin Public Health came together and developed conversation cards that are conversation starters for youth mental health. So those, I was looking at those last night and again this morning, and they just warm my heart, because as parents, we always feel like we have to fix it, right? Whatever it is, we have to fix it. I think what we are really learning now is we don't have to fix it. The conversation card doesn't have the answer for, ADHD or severe anxiety. It just has a conversation opener, and just to really talk about those feelings with our children and youth. And then I'll also say something like taking a youth mental health first aid course is really fantastic. Integral Care offers that.
Yes.
NAMI Central Texas, and I believe NAMI Texas offers basics, which is a basics about children's mental health, but also really a big part of it focuses on how to have those conversations with family members and children and youth.
Great. And that kind of, leads us to our next question. So as we've been talking about, right, there's an overwhelming number of factors that impact mental health. So what can parents do to help strengthen or improve their child's mental health?
On this one, I would just say, acknowledge that mental health is like what you said earlier, like physical health. You have to take care of it. And there's different phases in your life as a parent where, you've got small children and everything, and the older, with your parents get older, different things. Talk about reality of what's going on. Talk about how you deal with frustration and how it feels to you, and just try to normalize it. Stay away from shame and guilt of any type. And I think that comes with a stigma. I think it's hard for parents to understand, they're like, what do you have to be depressed about? You have everything in the world. We just took you on this trip. Doesn't matter. It doesn't matter. It's internal, and just listen to them. If they're saying this, they're saying it for a reason. Believe your kids. And I think every parent does. It's hard to handle as a parent, because it's like, well, I'm trying to do everything and my kid's having this. that's okay. You go to where the kid is and you deal with it from that point of view, but give some validity to it. And I think is when parents realize, my kid's not super kid, I'm not superhuman, and kids realize I'm not super kid, I'm not going to be the big time athlete that has 1 million followers on Instagram. That's okay. There's maybe 5. Okay, somebody's going to correct me on this, but what I'm saying, very difficult to pull off, and it's really okay. Can they be self-sufficient? Can they take care of themselves throughout the day? Can they prepare something to eat when they're hungry? Can they do things with 3 or 4 steps? Big stuff. Okay, big stuff. So
I agree, like even the pressure that some kids feel, and parents may not even blatantly be doing it, but like, I see kids and they're like, well, I'm taking 5 AP classes. I'm like, why are you taking 5 AP classes? And they're so stressed out and they want to get, these schools, which is good, but that pressure on kids is, I don't know, it seems more than when I was younger, right? Just the pressure.
Well, and even if there is that pressure, we can still help our kids learn how to manage it, right? We're not going to be able to avoid feelings or pressures or anxiety or all the things, and we don't know where that's going to come or where it's going to come from. But the important thing is, like we said, find some help for your, make sure you're getting the support so that you can help your youth through these things when they come up. We don't know when they're going to happen, but if we can help them have the coping skills, like you were talking about, these developmental things, can they take care of themselves? I think for, another thing to mention is, do they know how to reach out for help if they need help?
definitely.
Yeah.
Yes.
I'll add one last thing onto that, which is kind of tied into the whole technology piece. Is I think now more than ever, parents are battling against the influence of the internet. So it's the influence in the household versus the influence of millions and millions of people with all their individual ideas on top of all the kids that they go to school with. So I think historically, before technology was readily available, it was a lot easier for parents to be that main influencer and to be able to guide your children into the correct directions. Now you have pulls from friends, from what gets likes on Instagram and what kind of, becomes viral on TikTok that's pulling against what the parents' rules and expectations are. And so I think more than ever, a remedy for that is to make sure that you are trying to build the healthiest relationship possible with your children so that they come to you instead of going to the internet or going to their other 15, 16-year-old friends who might not know any more than they do in regards to a certain topic, whether that's their own relationships, whether that's friendships, whether that's decision-making. Should I do this challenge on TikTok for the likes, or should I understand that there's consequences out there for that? And so just making sure that healthy relationship is there. And I think a part of that also is understanding that for most parents, the way that, we were raised is much different than the way that our kids are being raised right now. Different eras, different generations, technology obviously is much different. So I think one thing that I've seen and what I kind of experienced myself with my own parents is a little bit of vicarious parenting, right? Maybe my dad wasn't so good at football, so now I'm going to make you as good as possible for football, but it might not be what your child wants. And so being able to attend to your child, being able to know what they actually like and don't like, being able to, to point them in the right direction with the things that they're interested in, but meeting your child where they're at, not necessarily where you want them to be, because sometimes those two things don't align. And when you try to force one or the other, it just creates more and more of a gap, more and more friction and more disconnect, right? And that's just going to lead them towards, going into probably some not so good role models or some not so good social influences. And so I think meeting your children where they're at is essential, not where you want them to be, not where you expect them to be, right? Because sometimes you'll see kids who go through those AP classes, like Melody stated, they hate it. They don't enjoy it. It's not bringing them joy. Then come next year, they don't even want to go to school anymore because AP just ruined them. Whereas maybe they would have been done better with just regular classes, right? Being able to have more free time to play a sport, to engage in the dance class or these extracurricular activities that have also dwindled over time, especially with the rise of technology. So, healthy relationships, of course, has always been important, but I think it's more essential than ever, just with the pull from all these other voices and all this other noise around them.
Yeah. And just talking with your, kids and normalizing, just also, I was wondering if anybody has any tips for talking to male teens because sometimes boys are kind of like, oh, don't talk about your feelings, you're not supposed to cry. Any tips on how to get, young men, teens to talk about their feelings? Derrick, you're the lone man on the panel. You ever get feedback on that?
I mean,
Come on,
really,
Derrick.
really what I've done is I just, open the door. I try to meet them where they're at. I try to make sure that they're comfortable in their space and that they know that our space and our shared time is just between us. And, before you know it, a lot of them just come out with some stuff that even for me, sometimes like, whoa, I didn't expect for you to just really jump into that topic like that. But it's building that comfort. It's building that space where one, they can disclose things without the fear of getting reprimanded, without the fear of getting in trouble or having their phone taken away or not being able to hang out with their friends anymore. But also meeting them where they're at. If they want to talk about girls or boys or their identity, whether it's sexual or gender, just making sure that you give them that space so that they can be true to themselves is really important. I think the same goes for even, female clients that I've worked with, adolescent female clients, which is as long as you give them the space, you maybe might assume that an adolescent male may not want to talk about something like sex with their female therapist and vice versa. But if you give them that space and they trust in you, then kind of that gender ideology dissipates. And it's just a human to human interaction at that point. And so giving them the space to express themselves, to be themselves and to feel comfortable. And they'll disclose everything that you want them to, and sometimes a little bit more. But like I said, we meet them where they're at.
Yes. We talked about kind of what to say. Any other comments about what not to say to kids who are in a crisis?
Okay, I think with kids that are in a crisis, the one thing we want to do is take it seriously, ask them what they're doing, if they've had thoughts. A lot of times when kids say thoughts of like self-harm, it may be something that they're hearing from others. They may be curious. It may be that they're really taking action, that they're engaging in risk-taking behavior or some type of self-harm. And I want to know those things. I do. And especially if there's, if it's something that they're doing as far as, cutting or hurting themselves or planning something, we take that very seriously. One of the things that we do, and I've done this in all my practices, are there guns in the house? Do you have access? Let the parents know, this is vital, can we lock these things up? Can we get them out of the house? Kids are very impulsive. And so they don't realize things are forever, and that some acts of self-harm, and I'm going to separate this. There's, some acts of self-harm like firearms, and then, and I'm not trying to make things superficial, but then there's cutting and things like this that, leading up to, we want to know everything. But what I'm saying is lethal means we need to know about. Parents need to know about it and be on the same page and not take for granted of, I've had firearms in my house all the time because I hunt. Your kids are in a different way of life right now. They're very impulsive and they don't understand forever. That's one thing kids don't understand is forever. Okay. They think things are all forever, but they don't understand their own mortality is not forever. And we don't want them to explore that either. So we ask these questions, we ask follow-up, we kind of keep it going of, hey, tell me this, hey, keep a journal. We have plans in place. There's different levels of attention that we give to this based on severity, but it's something we always ask about. What things that concern me as a clinician, things like, I'm getting off track here, but like choking games, that type of stuff. And so we don't want to say, well, they just saw this on TikTok, on social media, they're fine. If somebody's doing something that can impede their breath, harm themselves, endanger themselves, whether it's a Tide Pod thing or whatever it is, parents, we just need to know these things, and we need to kind of proof our house and be aware of what they're doing. And I'll tell you as a parent, you still don't know everything of what they're doing because they're not going to tell you. And that's just reality. So just be aware of your spidey sense, and you hear it from their peers, from other parents, and just be open-minded and understand your kid can be doing these things. It's not like because I'm a psychologist, no. There's no cover on this. Kids can do everything. So.
And I want to thank you for bringing up the lethal means. I'm a CALM trainer, counseling on access to lethal means, and their studies show that, that 25% of parents don't know that their kids have actually taken their firearm out, played with it, and put it back. And,
exactly.
you know, as we know with suicidality, that, you know, 50% of people only have that thought within 1 hour of doing, you know, attempting, and 25% attempt within 10 minutes of having the thought. So you're correct. If that lethal means is readily available, like guns, people use what they have and what they know. So that's a very valid point for, you know, safety, keeping your house safe. And especially like in these difficult times when kids are at risk and they're so impulsive, that, you know, it could happen. So thank you for bringing that up, Dr. Hart.
Can I add to that right quick? I would say don't ask these questions in a crisis, or when, you know, do it in a time or at a time when things are normal or are typical. Doing laundry, doing dishes, getting a snack, driving them somewhere,
yes.
right? Those are times that you want to bring up these conversations. And I'll just add too, because Dr. Hart, I was going to mention this when you were talking about crisis situation and suicide and hurting themselves. Something that we have in our household is my son knows, and we've talked about it, that this is the plan. If we see that you are having these kind of behaviors, then these are the questions we're going to ask you. We're going to wait until that time has passed and we can see that, and then you know, and then move on. But just having a plan and knowing that everybody knows, right? We even have talked about what it means to go to the hospital. And when we're going to ask you, do you think you need to go to the hospital? So having a plan beforehand, especially if your child or someone in your house does have a mental health diagnosis already, having a plan of what the family will do. But also if you're just having some symptoms and maybe don't really have a diagnosis yet, having you know, again, normalizing that conversation about what we'll do if something escalates or if parents see something different.
Okay.
Wonderful idea. I completely agree with that. That is wonderful.
And if I can just add one thing to be respectful of time that kind of intertwines with everything that both Dr. Hart and Nidia mentioned, which is making sure not to minimize or ignore when your child brings something up to them. You know, I have worked with families and you know, parents specifically and guardians where, you know, they feel like their child's suicidality is just, you know, false, or it's a cry for help, or that it's not legitimate. Right. And so one, if it is a cry for help, that's a sign that you should open that conversation and see what they need help with. But two, you never know when that time that you minimize or that time that you ignore is that time when they actually feel it the most, and they take those 10 minutes to actually find some sort of way to harm themselves and potentially take their own lives. So I think it's important to attend and to not ignore, even if it is a recurrent issue. And if it is a recurrent issue, I think that's a sign as a parent that, you know, maybe you should take your child for additional help, you know, or maybe you should kind of, you know, assess yourself as a parent and maybe kind of, you know, either access parental supports or your own resources that'll help you better attend to your child's needs. If it is something continuous, if you do feel like this is not real, this is just a cry for help, well, then there's something more that needs to be done to make sure that your child is managing that stress or in a better way, aside from just simply jumping over to suicidality or self-harm, or, you know, just even thoughts or plans or intents. So making sure to avoid minimizing, don't ignore it, make sure that you address it, because you never know when that one cry for help is the truest one that you've come across.
Yeah, thank you.
I
Derrick.
completely agree. And I would say to parents, get help with this because it is bigger. Don't do this by yourself. Be the parent and get professionals involved. So that way you can be the parent and you can get other people involved. It may mean people get into your business. This is a time you need other people involved. Your kid needs a parent, a mom and dad, a parent, guardian, but there are things that can help, and the feelings are so intense. You cannot solve this. Kick it up a notch and take care of yourself and your child.
Suzanne, that is an excellent segue into our next question, because my gosh, time's going so fast. But so what are some resources out there for parents and caregivers? So we've talked about everything that kids are going through. So what resources can y'all share with the audience?
So I can speak to maybe the resources we have available to here at Integral Care to our child clients. So of course we have, you know, different services from case management to psychiatry services to, of course, full-on therapy services. We we also do have multiple family partners that assist directly with the parents and to, build their own skills and to better manage their child's behavior or emotional functioning. There's even wraparound services for some of those kids who might be experiencing more severe levels of mental health issues, where you can, we have what's called the Yes waiver, which is, great for those kids who have not responded to more traditional forms of therapy, and opens up the door for them to potentially access non-traditional forms of therapy, whether it's equine therapy, which I found over time is extremely interesting, hard to get into, but very interesting, music therapy, art therapy, recreational therapy, just a bunch of non-traditional forms of therapy. So, simply stated, of course, I'm biased because I work for our local mental health authority, but definitely do research into your local mental health authority wherever you're at in Texas. You're sure to have one either in your county or in a county nearby.
Derrick, do you want to share the number for if you were to schedule an intake, say at Integral Care?
How many children come in for intakes on any given day?
Like you want to share the phone number?
Okay, yeah. So our phone number specifically for Child and Family Services here at Integral Care is area code 512-804-3000. And you can also contact the Integral Care hotline, which is 512-472-4357.
Perfect. Thank you. Who else would like to, Nidia or Suzanne, share?
Oh, yeah, I'll say, I see in the chat the asklistentalk.org is on there. Like I said, there are conversation cards in multiple languages. I believe the conversation cards you can also order them from the website. I don't know if that's already active or it will be at some point. Those cards are great. Youth Mental Health First Aid is a course, a one-day course that Integral Care does offer for the community at no cost as well. Basics, the NAMI basics is gives you the basics as a parent or a caregiver, gives you some basic information about mental health and mental illness, but also gives you information on how to communicate with children and youth.
Thank you. Dr. Hart, you have?
Yeah, an Awesome Child Guidance Center, you can call us as well. We see kids up to the age of 18 within within like 7 counties all around Austin. But we're at 512-451-2242. We have an intake division. We do counseling. We have a nurse practitioner that does all of our psych work as far as prescribing. We just have a lot of services. I really enjoy what we do, but we have therapy. We have PCIT, which is really good involved type therapy with children and parents. We have psych assessments as far as for school, if a kid's having issues in school, learning disabilities. But I would say get involved. If there's many places out there, a lot of people have a waiting list. If somebody has a waiting list, go somewhere else. If you're in an area that doesn't have something, call around. We work with different, like with Texas A&M Child Psychiatry Network. So they come to us for ADOS testing. We test for autism, people that may have suspicions of ASD, so autism spectrum disorder. So we have different people that reach out to us, but I would say in Texas, it's not just what your insurance has. There are other places, and just keep looking and ask around. There may be local churches, local community groups. You're going to get a lot out of your community groups because that's where all the practitioners are starting, the clinicians. So you're going to get, I really want to advise this, really the latest research. You're going to get pretty good technology, and you're going to get people that are really on top of their game because they're coming through, and that's where they can get their hours. So every time I've worked with them, I really enjoyed it. I worked with them through adults, City of Houston, Harris County Jail, all kinds of things, same Houston State. You can get everything with every type of local authority. So try there. And then if that doesn't work, keep going elsewhere.
And that's what I was thinking too, like if people have private insurance, again, I don't know everybody who's in the audience, but you can always contact your insurance company and they will help you try to find a provider. There's also, like Psychology Today, find a therapist. A lot of people don't know about that, but that's, if you just want a therapist, you can put in like, I have Aetna and I need a male therapist who's bilingual. Then you can know it'll pop up all the various therapists in your area that, take your insurance and are open to see clients. So Yeah, so that's another option. So we have about 12 minutes left, and so there is some questions that if you see me looking down, it's because Mary's sending me questions. So I thought this one was interesting. So we're gonna just do a little, a couple of, questions. Everybody else, if you have more questions, put them in the Q&A. So how reasonable is it for us to expect our pediatricians to handle mild to moderate mental health issues? Anybody have any experience with that?
I think it's kind of reasonable, but they're not equipped. I mean, if they're at a local place, they have to see people by the numbers. If they're diagnosing ADHD based on a questionnaire that a pharmacy company has written up, I would say go further for that to get real testing with something like a continuous performance test. But I would say as a starting point, it's good to know they're going to ask some questions, but they may just be screeners. And so if that's the starting point, that's fine, but they cannot solve everything right then. It's asking a whole lot in a very small amount of time. I would get a referral for them for psychiatry, for a nurse practitioner, somebody PA in psychiatry, and I would also get for therapy as well for behavioral health. And I would go from there. Putting all of the pressure on one pediatrician is too much.
Mhm.
Yeah, I agree. I almost hate to bring this up. Any comments on our political arena right now and with transgender youth or anybody like
I'm going to go out there because I'm outspoken, and I'm just going to say right now is a scary time for our youth and families. And I think our young people know this as well as older. And I would put your child first and really listen to what's going on with them. And if it's something so detrimental to their health, maybe a geographical move might be in order. I'm just saying, put your kid first because they come first. And if you can do that with jobs and everything, but right now I'm just saying it is very threatening.
Yeah,
I agree.
I think thoroughly it's just, I think it's a sign of just our political system. I don't think they really listen to what we really deal with here on the ground level, I guess is what I'll call it. And especially, if you interview and you speak to people who are transgender themselves or have children who are transgender, it's concerning, and it's, they're human beings too. They have their own wants, wills, drives, rights, responsibilities, as well as, civil participants in our society. And so it is very concerning, but I think it goes back to having that open and honest conversation, protecting your children, putting them first. And, when it comes to politics, it's one of those things where a lot of the decisions that are just being made on multiple fronts, multiple levels, do not make sense to us on the ground. And that's just kind of something that unfortunately is out of our control. But I think something that most of us can control is the communication in our household, the communication with our children, and how we decide to address it with them. And like I said, if it really gets down to, having to take it into your own hands and geographically relocate, then that's something that, should be considered if at all reasonable. But put your children first. I think politics will always work against us in some way, shape, or form, unfortunately.
I agree.
I completely agree.
Thank you all. Yeah, it's a difficult time, that's for sure. Here's a question too. How can I talk with a 6-year-old about his mother's passing? That's a tough one. Any comments or?
That's very hard. I would, well, they definitely can talk about it, and the conversations will change based on recency, but you can, you can go on a walk. You could, kids, if you get them on the floor and you're playing, they will tell you whatever's going on. So if you want to play with cars or toys or color, and just spread some stuff out and hang out with them, turn off the phones, so you don't get any messages. And then if you want to take a ride somewhere, most stuff happens in the car. The conversations happen in the car there or on the way back. It might be in the last 5 minutes, but a lot comes out. But it's okay. You can bring it up and, and just wait them out. But I think by having it open to where they can share, they will eventually.
Yeah. And just to segue that really quickly, respectful of time, I think starting that conversation early will open the door for questions that may come along later on down the line, where they're more mature, where they're kind of seeing, they have a better understanding of the world and how families function and what they might be missing in comparison to their peers or those around them at school. And so I think starting that conversation early opens up the door, hopefully, best case scenario, later on down the line, when some of these questions become more complex, beyond a 6-year-old's level of understanding.
Yes. great.
Definitely agree.
Should we ask kids if they have considered suicide? I could answer that, but I'm not on the panel, so I'll let y'all answer that. If not, I'll answer it.
We ask that in screening all the time. I ask stuff all the time. I don't, it's okay to have thoughts and feelings, it's, kids hear about things, they wonder why. It's not going to cause a child to do anything by any means. So yeah.
I think that's what parents need to hear, is that talking about it doesn't put it in your child's head.
No.
Yeah. They've already, if they're thinking about it, it's already there.
Yeah.
Yes.
I was going to say, I think that's what, for me, that's what the question is a lot of times that I hear from parents is, should I even say it? If a child or youth is bringing that up to you, either, clearly saying suicide or hurting themselves, then they've already had that thought, either from themselves or from a peer group, or they might just be wondering about it.
Yep.
Again, that youth mental health first aid, part of that program is practice saying that out loud. It is a difficult thing to even imagine, but just like we talk about it being first aid for a mental health crisis, it's you kind of have to practice that. Just even hearing yourself say it out loud, especially to a child or youth. And again, absolutely correct. If they're bringing it to you, they've already thought about it, and it's best to have that information from an informed adult that they're trusting, right? They're coming to you about that, instead of misinformation for them.
Yes.
So yeah, I would say if they're bringing it to you, then yes, talk about it. And us bringing it up doesn't mean that idea gets put in their head, is what we hear a lot of times parents say. The kids are talking about it, we're seeing it, kids are feeling it. So definitely something to talk about. And I'll say another thing for us as well. In our house, we don't say we're done, because we don't just say we're done and walk away, right? You could say I need a break, but we will come back and finish having that conversation as well. So those are just some communication boundaries, if you will, that we've set up in our house. We don't say we're done and walk away. You can say I need a break, or I'm done for the next 5 minutes, but then we're going to come back and finish it. So again, practicing having those conversations so that we're laying that foundation of having that open relationship with the children in our children and youth, either in our family or in our lives, right? I've got nieces and nephews as well, that I want to make sure that they have an adult, that they feel that they have an adult that they can come to if they have those questions.
Yes. So again, I think it all has to do with normalizing, and even like we talked earlier about, like, if kids' behavior changes from their baseline, I think it's even then to say, hey, you ever think about wanting to hurt yourself? You don't have to use even the suicide. You ever think about killing yourself? That's what we teach in Calm. It's okay to say that, and so then it kind of, again, I hate to say normalize that kind of behavior, but at least it kind of opens up the dialogue, that if they're feeling it, they're like, wow, I can talk about this, because as so often when people die by suicide, people always say, God, I never knew. They look so happy. So I think just even in this day and time, having these mental health check-ins with our kids, even if they're doing okay, you think they're doing okay, just saying, hey, you doing all right? Can I do anything for you? Do you need anything from me as your parent? Can I do anything better as your parent?
Right.
So it gives them that opportunity to talk. So
I get you a snack.
Yes. And I hope everybody, we're almost out of time, and I hope everybody is reading the chat, because there's some great resources in it. Christie Center, I was thinking that when we were all talking about the little 6-year-old.
Yeah,
Christie Center's
definitely.
Great for.
They're wonderful.
you know, helping people dealing with grief and loss, love them. So please, yes, look these over. If we did get to your question, we will be reading these over when we're done. And get back with you if you have your email address attached. But I just want to thank all our panelists for your time and insight, and thank you for everyone who joined us today. I do want to end again, Dr. Murthy, our Surgeon General, he's great. I just want to end with a quote that he had out of his report. If we seize the moment, step up for our children and their families in this moment of need, lead with inclusion, kindness, and respect, we can lay the foundation for a more healthier, more resilient, and more fulfilled nation. I couldn't have said it better. So, thank you so much. When the forum ends, you'll be prompted to take a short survey. So we'll hope you'll take a few minutes to share your opinion. And I want to say thank you again for joining us. This is such an important topic and dear to my heart. And any last words, panelists?
I would just say,
No, go ahead.
I would just say, listen to your kids, listen to yourself. If you're questioning if you need support, just get it. You'll be fine. I mean, sometimes it's just taking the initiative, but don't put off your own needs at all. Your kids are watching you and they're going to model after you. So just really advocate for yourself. When you advocate for yourself, you're advocating for your kids.
Yes, well
Yeah.
said.
What I'll say is there is no perfect parents. All you can do is try your best.
That's right.
And it is,
Bring a snack and have the conversation.
and it is the hardest job in the world. Just had to put
It
that on
really
there.
is.
Yes,
It is.
definitely.
It is.
It really is. But it's very rewarding, you know, so. All right, thank you all so much. Great timing, 1 o'clock, we did it. Again, I really appreciate everybody taking their time to join us today. Thank you.
Thank you.
Thank you.
Oh.